common myths about depression. Folk remedies and half-truths about depression are very common among us. One such idea is hard work reliefs depression. For mild cases of depression, it may work. But in reality, overworking can actually be a sign of clinical depression, especially in men. Depression is not a real illness is another myth. Depression is a serious medical condition, not an ordinary sadness. Functional brain scans shows the biological evidence of the disease with abnormal activity levels. The neurotransmitters that carry signals between nerves also appear to be out of balance in depressed people. Depression is not just a self-pity as believed. People who have clinical depression are not lazy or simply feeling sorry for themselves. Depression cannot be vanished when they wish. Depression is a medical illness and a health problem related to chemical changes in the brain. Like other illnesses, it improves only with appropriate treatment. Depression means drugs for life is another myth. Medication is only one of the tools used to lift depression. Even if antidepressants used, it is not for lifelong. In fact, studies suggest that counseling works as well as drugs for mild to moderate depression. Depressed people cry a lot is a belief, but not always. Some people don't cry or even act terribly sad when they're depressed. Instead, they are emotionally blank and may feel worthless or useless. Even without dramatic symptoms, untreated depressed people can live a full life, but as a burden on their families. Teens are unhappy by nature is our common belief. Yes, many teens are moody, argumentative and fascinated by negative thoughts. But prolonged sadness or irritability is not normal for teens. If unhappiness lasts more than 2 weeks, it may be a sign of depression. This develops in about 1 in 11 teens. Other signs a teen may need help include being constantly sad or irritable even with friends, taking no pleasure in favorite activities, or a sudden drop in grades. Depression is part of aging is another myth. Anyone can navigate the challenges of aging without getting depressed. But when it does occur, it may be overlooked. Older people may hide their sadness or have different, vague symptoms such as, food just doesn't taste good anymore, aches and pains worsen, or sleep patterns change. Medical problems can trigger depression in seniors. Depression slows their recovery from a heart attack or surgery. Depression is tough to treat is a myth. In reality, most people who take action to lift their depression do get better. In a large study by the National Institute of Mental Health, 70% of people became symptom-free through medications. Need not always with the first medicine. The best treatment is combining medication with counseling. Talking makes things worse. People were once advised not to discuss their problems by talking about them. Today, there's evidence that guided discussions with a professional can make things much better. Different types of psychotherapy help to treat depression by addressing negative thought patterns, unconscious feelings, or relationship troubles. The first step is to talk to a mental health professional openly. Thanks for watching. Please click the link in description for more information.